Hello, everyone. Welcome to today's webisode. I'm Andrew Uhas, a health services specialist here at Geisinger, and I'm excited to be joined by my colleagues and fellow health services specialists, Olivia Marchioni and Abigail Morrison. Today, we are discussing how social needs shape our health. When we think about health, many of us picture doctor's visits, medications, or even exercise routines. But research and experience tells us that health begins much earlier and is shaped by the conditions of our everyday lives. Today, we'll be talking about social needs, factors like housing, food access, education, as well as social connections. These elements are extremely valuable as they influence how long and how well we will live. So there is a lot to explore, and I'm really looking forward to this conversation. But before we begin, I do want to share just a quick disclaimer with everybody. This information is being provided in order to increase your awareness, and it is not intended to be used as medical advice. If you believe that you may have a medical condition or specific questions regarding your health, please speak with your physician. So to start us off, Olivia and Abigail, thank you so much for joining me today. I really appreciate both of you being here.
Thank you for having us.
Absolutely. So before we dive into specific examples, I think it's important that we make sure that everyone's on the same page about what we mean when we say social needs and why they matter in conversations about our health. So Olivia, could you start us off by explaining what social needs are exactly and why they are such a fundamental part of our overall health and well-being?
Sure, it's a great question. At Geisinger, we really understand that social care is about overall health. It doesn't necessarily have to be clinical care, it is overall health and well-being. So Geisinger goes above and beyond traditional medical care and integrates social needs screenings. You might have heard of social needs as social determinants of health. That is another term that we use interchangeable. Some examples include access to safe and stable housing, nutritious foods, reliable transportation, and education and employment. We'll be talking about all of them throughout this webisode, and it's really important to know that social needs, they meet individuals above and beyond. And when you do have a social need, you might be able to not manage your stress well, access health care, and also not have healthy choices like stable housing and nutritious foods. So today we'll be talking about both physical and mental well-being.
Awesome. Yeah, that explanation really helps ground the conversation and expands the way that we define health. Because when we recognize that social needs are a part of our health, it shifts how we think about things like prevention, care, even long-term support. And it also helps paint a picture why two people with this same medical condition can experience very different outcomes based on their daily circumstances. So once we start to think of health in this broader sense, it becomes more clear that medical care is just a piece of that puzzle. And sometimes these social needs don't show up in the most obvious ways. And many people might not even realize what they're experiencing is connected to something bigger going on in their lives. Often those challenges show up in smaller everyday signs that we might overlook before they turn into a larger health issue. So for my next question, what are some everyday signs that might indicate someone's social needs are affecting their health? And what's maybe a practical first step for outreach and having that conversation?
Yeah, that is a great question. Geisinger defines social needs as conditions in which affects us in learning, playing, working, and a wide range of health outcomes. So we want to look at the social need that is infecting someone's health. We can recognize it as not always a medical issue. In fact, it is not always seen by a doctor. It's seen outside in your communities. So challenges like food insecurity, unstable housing, lack of transportation, financial stress, and social isolation can go unmet. Some examples also include limited access to food, missed appointments, and missed medications due to transportation or cost barriers, chronic social stresses, including financial and housing concerns, social isolation or loneliness. This can be due to depression or lack of social support, and then difficulty managing daily responsibilities. So, a first practical step is to really talk to someone that you can trust, whether that's a provider, a family member, a social support. A local community organization is also great, or also your provider. So, by asking them for help or just saying, you have difficulty managing daily responsibilities, we can start you off with a social needs screener, and we'll be able to connect you to resources that could help with this social need.
Awesome. That's super helpful to hear because it really just shows how subtle these signs could be. As I mentioned, it's not often just one big moment, but more of just a pattern of those small changes that can really lead to something deeper. It also reinforces how important it is to notice those shifts, to check in, whether that's with ourselves, community organization, healthcare provider, or just someone else. We need to remember that starting these conversations does not have to be perfect, but it also doesn't need to be overwhelming. Sometimes just simply asking a question, sharing a concern, that could open the door for support and help address these challenges before they become a crisis. When we start paying attention, we can see that they often connect back to whether or not someone's most basic needs are actually being met. So, applying that to the bigger picture, uh, let's look at something that is one of the most basic human needs, housing. So, Olivia, follow up question. How does having, or of course not having, safe as well as stable housing directly impact both physical as well as mental health?
Sure. As you can imagine, stable and safe housing is really essential for someone to have a good mental and physical health. You can simply think of where you put your things, or a refrigerator, or, fresh water, any kind of need that could be in a house that you would need. So, when people have stable housing, they are also able to sleep better, eat regularly, manage chronic conditions better because they might have a place to relax, and they can recover from an illness faster. So, when a person has unstable or unsafe housing, they can be exposed to poor living conditions. They might not be able to have fresh water sources, fresh foods, and they might have to go to like a community organization to get that support or to get stable housing. This can also make it harder to access daily health care or any kind of appointments because they might not have the means to get to an appointment, and they might be in several different locations. Mental health can also be impacted by housing instability by causing a higher increase in anxiety, depression, social isolation. So overall, housing and safe housing can very much meet a basic need, and be a social need for someone's physical and mental health.
Yeah, absolutely. To your point, housing is much, much more than just simply having a roof over your head. It's safety, it's stability, it's that sense of security. And when we know those things are missing, stress levels will increase, daily routines can fall apart, and managing your physical as well as your mental health is going to be significantly more challenging and in turn would be essentially put on the back burner. So it really underscores how closely housing and health are going to be connected. So, just like housing, access to food is playing a critical role in our health as well, yet not everyone has that same access to nutritious food options. So, what are the health consequences when individuals or even families lack that consistent access to healthy food?
For sure. So this could impact individuals or families when they have a lack of healthy foods. Also, if you don't have, stable housing, you might not have a kitchen to cook healthy foods in. So poor nutrition can result in vitamin and mineral deficiencies. Also, a weakened immune system, especially if you are already have an illness or an infection, it might take longer to heal. Also, fatigue and low energy, making daily activities more difficult. Self care might be a little bit more difficult. Um, and then with children, it's a big issue for delayed growth and development if you're not getting all of your vitamins and you don't have access to the fresh foods. For example, milk is very common for a child to have. So that's something that, could, if you don't have that, that could delay growth. Worsening health conditions as well, such as, eating a poor diet could create obesity, and then lack of physical exercise. So all of that kind of ties into a person's physical and emotional well-being. So I think that's why having food and not being food insecure is so important. There are local food banks that we will talk about later on with a resource called Neighborly PA. So that's something we can address.
Yeah, absolutely. Food insecurity, it's much more than just hunger, as you mentioned. Without that, reliable access to nutritious food, we're going to struggle with, just to recap, energy, chronic condition management, as well as just our long-term health. But it's also going to impact families over generations. It's going to shape our routines, our development, as just well as our overall wellness. So another factor that doesn't come up that is super, super important is education. So, can you also speak to how an individual's education is going to influence their health, their opportunities, as well as their life expectancy?
For sure. Education has a powerful influence on a person's health, life, opportunities, and overall expectancy in shaping knowledge, resources, and even access to healthcare. We don't usually think about education or employment being a strong factor, but the two factors that we can really conclude on when we think about education level is health. So, a higher education allows us to have a higher health literacy. This allows us to understand medical information, have preventative care, a little bit more understanding and making life decisions. And then opportunities. When we have education, we are able to access more stable jobs, and that could also include health insurance in a position. These opportunities could help financial stress and make it easier for affordable health care, also healthy foods and stable housing. So really the umbrella picture of education and employment can help address other social needs as well.
Yeah, absolutely. Education definitely shapes health over the entire lifetime. It influences communication skills, employment opportunities, and like you said, confidence, and just simply navigating healthcare systems and having that access to reliable health information. These factors are all going to play a role in long-term health outcomes. Another important thing to mention is just how relationships and social connections also affect our health. So, Abigail, would you be able to take over for Olivia, and could you answer what these roles do in social connections, whether it's the lack of them, and how they play in mental and physical well-being?
Sure, Andrew, absolutely. So, social connections play a crucial role in overall health by helping to reduce stress, supporting mental well being, and improving physical health, all of which can contribute to a healthier and longer life. When we look at someone's physical health, maintaining strong social relationships is associated with a reduced risk of chronic conditions and overall health. Socially connected individuals often experience better immune function, higher cardiovascular health, and more energy throughout their daily lives. And then when we look at mental health, meaningful relationships provide emotional support, a sense of belonging and purpose, which can help combat anxiety and depression. Social connection is also an important factor in recovery from mental health challenges. And then when we look at stress management, supportive networks, including family, friends, and community members, offer protection against stress and help individuals cope more effectively with life's difficulties. And that takes me to healthy behaviors. People with strong social ties are more likely to engage in positive health behaviors, such as maintaining a balanced diet, staying active, and getting adequate sleep.
Awesome. Yeah, it's eye-opening to think of social connection as a true health need rather than just something extra. These strong relationships, to your point, provide emotional support, they reduce stress, and they can improve health outcomes overall. Where, on the other hand, isolation can worsen existing health conditions and make it harder for individuals to go and seek help.
Absolutely.
Those social connections often develop within the communities where we live, as you mentioned. So Abigail, how do community factors such as safety, transportation, as well as access to resources influence our health?
Sure. So when I look at these community factors, as you mentioned, they profoundly shape health outcomes by influencing daily choices, stress levels, and access to care. Safe neighborhoods enable physical activity, while reliable transportation ensures access to healthcare and nutritious food. So when I look at safety and environment, we realize that high crime rates, violence, and pollution directly impact physical safety, mental health, and stress levels. Conversely, safe, walkable, and clean neighborhoods encourage exercise and social interaction. And then take transportation, for example, and access to that. A lack of reliable transportation leads to missed medical appointments, delayed care, chronic disease mismanagement, and reduce access to healthy foods. Conversely, good public transit improves access to jobs, services, and amenities, which reduces social isolation. And then when we look at access to resources, limited access to supermarkets, healthcare providers, or green spaces contributes to higher rates of obesity, diabetes, and heart disease.
Those are excellent points. Sum that up, community environments, they're influencing our daily choices, how stressful our everyday is, as well as just opportunities for connection and healthcare. When we look at strong, supportive communities, they can play that powerful role in promoting better health for everyone. And then when many of these social needs are going unmet, whether that be housing, food, finances, connection, stress becomes constant. We've already mentioned stress numerous times. So a follow-up on that is, how does chronic stress caused by these various social challenges contribute to long-term health conditions and consequences?
So, to answer that question, Andrew, chronic stress from social challenges such as discrimination, isolation, or poverty causes long term health conditions by triggering the constant release of hormones like cortisol and adrenaline. This sustained high level activation of the body's stress response leads to chronic inflammation, immune system suppression, high blood pressure, and metabolic disruption.
Yeah. Yeah. Understanding that connection really helps explain why these unmet social needs have such a significant impact on our health, how chronic stress affects the body's functions over time, even increasing, risk for conditions like heart disease and diabetes, of course, really highlighting why prevention needs to include social support, not just medical treatment and all of the other social determinants of health. One thing we don't talk enough about, in my opinion, is how hard it could be for people to actually bring these things up. Social needs are deeply personal. And for a lot of folks, these conversations about food, housing, financial stress, they can feel uncomfortable. So many people feel embarrassed or just hesitant to talk about their social needs if they do at all. So what advice can you provide to help individuals advocate for themselves when they're talking with a healthcare provider?
This is such an important conversation, Andrew, and advocating for social needs, whether it be food security, housing, transportation, or social support, is truly vital for someone's health. And to overcome hesitation, prepare a written list of needs, bring a trusted support person, and remind yourself that providers who are trained to listen without judgment need the information from you to offer effective care. Openly sharing these factors allows for holistic care and access to necessary resources. So, what I thought we would do, Andrew, is sort of share some things to keep in mind for before, during, and as a follow up to the appointment. So, when someone is preparing for their appointment, they will want to write it down. So, make a list of your social challenges, whether it be you're struggling with transportation or affording medication ahead of time to make sure they are addressed, even if you feel uncomfortable. You will want to rank your concerns and your needs so that you discuss the most critical issues first and go into an appointment with an identified goal. So be clear about what you need from your doctor, whether that's a referral to a social worker or finding a pharmacy with delivery, for example. And during the appointment, you will want to be open with your provider and um, engage in that conversation with them. Let them know that you're feeling a bit uneasy, and definitely take that support person with you so that you have someone who knows you and who cares about you there to support you through the process. And then once your provider knows about your needs and you've disclosed that, um, definitely follow up on the conversation if you end up with additional questions or need to further engage your provider in another conversation about your needs should something arise or you want to follow up with them.
Awesome. I'm glad you shared tips for that entire patient experience before, during, and after. Uh, it's also just a good reminder that these conversations take trust. When participants feel respected, supported, and not judged, it becomes easier for us to open up. It also speaks to how important it is for healthcare teams to create that space where people feel safe, they feel welcome, they feel invited. And that way they can really share what's truthfully going on in their lives. And it's so important to call out that asking for help or identifying a challenge is absolutely not a failure. And it's a strength. And we need to realize that it's a key step for us to take care of ourselves and to, go towards better health. So these topics can feel really overwhelming. But as I've mentioned before, meaningful change is going to start with small steps. So as we sort of conclude today, where can individuals go to identify social needs and improve their well-being?
So Geisinger in 2020 partnered with neighborlypa.com as a way to bring um, community-based organizations to the forefront in order to partner to meet patients and members' needs. So please visit neighborlypa.com. As Olivia mentioned earlier, you will want to search in the upper left. You can search by zip code or by social need, and they're all there on the banner for you to choose from. So whether that's food, housing, transportation, other supports, care, all of the social needs are listed, and you will be able to find support right in your zip code. Neighborly is also available as an app on your Android or iPhone, and there is a green rainbow icon that you can identify Neighborly by before downloading the app.
Excellent. Neighborly is an absolutely excellent resource for everyone to utilize. So thank you for sharing that. And as a recap, to find community resources near you, simply just go to www.neighborlypa.com, and I will put that in the Q&A so anybody that is watching live will be able to have that link right at their fingertips. But again, that website is www.neighborlypa.com. So today's conversation really reminds us that health is shaped not just by what happens in hospitals and clinics, but by the conditions of our everyday lives. When we address things like housing, food access, education, and connection, we are improving our lives. So again, I really want to thank both Olivia and Abigail for joining me today. We hope today's discussion inspires you to see health and healthcare through a wider, much more compassionate lens. And if you have any questions or feedback, feel free to send them to wellness@geisinger.edu. Or again, if you are watching live, please feel free to put those in the Q&A chat and we will get back to you as soon as possible. And don't forget to join us next month when we will be discussing how you could better understand mental health as well as learn some skills to decrease stress and avoid burnout. And again, if you have any questions, you could feel free to email them over to wellness@geisinger.edu, and I will be throwing the Neighborly link in the chat for everybody. But thank you all so much for listening, and I'll see you next time. Bye-bye.
Thank you all.
Thank you.